for drowning. Drowning is a type of suffocation induced by submersion or immersion of the mouth and nose in a liquid or water. And sometimes it may happen due to accidental fall in river, pond, well, and if the person is unable to swim and in drowning, mouth and nose are completely submerged into water and small quantity of water enters into the lungs. What is drowning? So that's what we have seen, that someone has difficulty breathing because their nose and mouth are submerged in a liquid, and when someone is drowning it may not always look like distressed, call for help, and most of the time it may be happen by unnoticed, and they may go unnoticed even if friends or family are standing nearby. Classification and types of drowning. Two types drowning, that is dry drowning and wet drowning. Dry drowning is a drowning where the water did not enter into the larynx, and wet drowning, drowning where water enter into the larynx, goes into the laryngospasm. Certain factors make drowning more likely, and people those are not aware of swimming, and many adults and children report they can't swim or they are weak swimmers, and missing or ineffective sensors around water, and lack of supervision, and even some location. And even you can hear so many news in the social media, the newspapers, that the people those go for this some picnic or somewhere without wearing a life jacket. You can see the person is without a life jacket, and even the people though may have taken any alcohol, beverages, and using drugs at the time of swimming, and even though if they know to swim also, if they have taken drugs or some medicines, it may also cause drowning. What are the signs and symptoms of near drowning? So there will be an abdominal distension, chest pain, and blue discoloration of skin or extremity and face. That's we call the cyanosis, cold and calm skin, and irritability, and the person may be restless, lethargy, and no breathing, severe breathing difficulty, and consciousness. And all general signs and symptoms of asphyxia, that is there may be an obstructed airway and mainly congestion in the lungs, and the froth come outside and in around the lips, mouth, and nose. First aid measure of drowning. So the first one, you have to call, reach, throw, tow, row, and go for safe rescuing. And the person those who are rescuing also make sure he is in the safer side. First one, get help. So notify a lifeguard if someone is close. If not, ask someone to call 108. And if you're alone, a rescuer, single rescuer, you have to follow certain steps. The first one, move the person. Take the person out of the water. So the first one, how we can take out of the person? First, you have to reach the victim immediately and drag the victim with the help of rope, towel, or shirt or stick out of the water. And when you are taking out the victim, you have to place the victim in a prone position to drain out water from the lungs, and make the victim stable, and place your ear next to the person's mouth and nose, and feel air on the cheek, and look to see if the person's chest is moving. And in case if the person is not breathing, check pulse for 10 seconds. So you can see for any obstruction in the airway, eliminate immediately. And if there is no pulse, immediately you have to start CPR. So for adult, carefully place the person on the back, place the heel of one hand on the center of the chest at the nipple line, and you can also push with one hand on top of the other. And press down at least 2 inches, and you have to make sure you are not pressing the ribs because you may damage the ribs, and do chest compression only at the rate of 100 to 120 per minute or more, and so make sure the chest rise completely between push-ups, and check to see if the person has started spontaneous breathing. And for a child, the CPS starts with the respiratory breathing, that carefully place the child on their back and tilt the head back and lift the chin. For a baby, always you have to be careful not to tilt the head back too far. And with an older child, pinch the nose closed and put your mouth over the child mouth for mouth to mouth breathing. So this will be caused by forming a tight seal. And with an infant, place your mouth over body, over both the baby's mouth and nose. So for infant, for less than 1 year, you have to cover your mouth with the ender part of your baby's nose and mouth. And blow into the child's mouth for 1 second, and we have to check for the chest rising. And repeat the breathe the second time, and then begin again the chest compression. So for a child, place the heel of one hand on the center of the chest at the nipple line, and in case for an infant, 2 fingers on the breastbone, and here also you have to press the deep, that is 2 inches for a child, and for about 1 to 1.5 inches for an infant. And here, like adult, you have to make sure you are not pressing the ribs or the end of the breastbone. And for child, do 30 chest compression on the rate of 100 per minute, and make sure the child chest rising completely, that is spontaneously, and check to see if the child has started breathing. And repeat if person is still not breathing. So if you have been trained in CPR, you can now add 2 rescue breaths to the adult CPR cycle. And next we have to open the airway by head tilt and chin lift method, and pinch the nose of the victim closed. Take a normal breath, cover the victim's mouth with your mouth, rest your mouth to create an airtight seal, and then give 2 1 second breaths as you watched for the chest to rise. And again, you have to give 2 breaths followed by 30 chest compression. Continue the cycle of 30 compression and 2 breathe until the person starts spontaneous breathing or till the emergency help arrives. And first aid measure for drowning, shift the patient to hospital. So finally, you have to start manual breathing if the victim is not breathing. So then next you have to arrange for transportation and send the victim to the nearby hospital.